speaking against a tentative agreement with the government and the BCMA. Dr. Roland Orfaly is Executive Director of the Anesthesiologists Society. And Dr. Orfaly, I want you to hear what Dr. Shelley Ross told me yesterday. She's the new BCMA president. You sound very positive, but as soon as that announcement was made, the BC Anesthesiologists Society was blasting the agreement, saying it simply pouring money into a flawed system.
Well, we knew what they were saying. We really were paying attention to their concerns because one of their biggest troubles is trying to get enough anesthesiologists to work in BC when they can go to Alberta and make much more money, they tell us. So our negotiators paid particular attention to that, and part of the agreement is new money to help them with recruitment and retention for all specialties, including anesthesia and anybody else that feels they're having this problem.
Dr. Orfaly, good morning, and tell me what your response was to what Dr. Ross said.
Good morning, Bill. I think what you need to do is step back for a second and look at the bigger picture before you talk about one little piece of what the BCMA says is a solution. You know, in this province, taxpayers spend 42 cents out of every tax dollar on health care. And you have to ask the question, with $17 billion a year going into health care, why are patients suffering the way they are? Why are there 73,000 British Columbians waiting in line for surgery right now, which is double what it was a decade ago? Obviously, the money is not going where it needs to be going. It's not being spent efficiently. So, and you know, this is a question I keep getting asked. Well, why are we spending double what we spent 10 years ago and getting less for it? And one of the problems is that the cost of administration in the healthcare system is ballooning. Just over the last 3 years, during the worst recession in recent history, the budget for administration in BC's healthcare system has gone up 28%, or $303 million increase.
And that's during the worst recession in memory.
In memory. I mean, we spend $1.4 billion a year just on administration in the healthcare system. Imagine how much patient care you could have delivered with that money.
You have come out with a paper that details a lot of this information, and part of that paper says, on average, there is one administrator for every 2 hospital inpatients?
That's correct. And when you look, I mean, BC spends more on administration in healthcare than other provinces, 20% more than oil-rich Alberta, 24% more than Ontario. And Canada is not exactly a lean country for this. Canada has 10 times the number of health bureaucrats as European countries like Germany. So we have a lot of room to maneuver if you actually wanted to improve healthcare in BC.
Well,
These are the types of questions we want to be asking, and we simply have been shown the door because we won't ask the tough questions.
You talked about St. Paul's Hospital back in the 1980s with 6 administrators and 475 inpatient beds.
That's right. And the number I'm told today is we now have more administrators than inpatients at St. Paul's Hospital.
Well, according to your paper, St. Paul's has 380 administrators and only 325 inpatient beds.
Correct. And what we're seeing, not just at St. Paul's, but at hospitals around the province, is you have rooms that used to have patients in them, used to provide actual patient care, that have been renovated and are now used as offices. Not by healthcare staff, but by administrators.
How does Canada compare to other countries?
You know, like I said, if you look on a per capita basis, the number of healthcare bureaucrats in Canada is about 1 for every 1,400 population, which is more than 10 times what they have in Germany. There's 1 bureaucrat for every 15,000 people. It's just a phenomenal growth industry if you want to be a health bureaucrat. But the question is, you know, especially during a recession, if you say that you want to be fiscally responsible, why are you spending $1.4 billion on administration instead of on actual patient care? So these are the questions that we want to bring to the table. And, I mean, you bring up the BCMA. The question that we wanted to bring to the table was there's $3 billion that flow through the BCMA every year for physician services. We wanted to ask the same question. Where is all that money going? $756 million of that is new money over the last decade that this government gave to the BCMA to fix recruitment and retention problems, which are worse today than they were 10 years ago. So where did all that money go? But instead of letting us ask the question, they kept us out of the room. The government of the BCMA appointed a conciliator back in February to independently look at the situation and suggest an agreement. Well, when the BCMA and the government found out that we had a right to actually sit in front of that conciliator and ask those questions, they refused to meet with the conciliator, and they signed a deal without ever going through conciliation. Why? Because they don't want the questions asked. Minister de Jong does not want to face these questions because they're the real ones that affect the patients who need the care.
Now, all of this information is available publicly or going to be on your website?
Correct. We have a website, bcdeservesbetter.com, and there's a lot of information there already about wait lists and how patients are suffering, as well as on how all of this money is being wasted and could be better used. And we want the public to actually go there, read a bit about what's really going on, and share their information, their stories, and their feelings about this. You know, in the end, the only way that the system is going to change is if the people on the ground, British Columbians, talk to their government and say, we need you to be accountable for all the money we're giving you for health care.
You say that the BC budget for administration and health is increased by 28% over the past 3 years.
That's $303 million increase in the annual budget.
For administration?
For administration. And this is all based on publicly available accounting records from the Ministry of Health and health authorities.
That would buy a lot of anesthesiologists, wouldn't it?
That would buy a hell of a lot of patient care bill. Sorry for the wording. But, you know, it's true. I mean, you come back and you talk about the number of patients and the number of administrators. Let me ask your listeners this question. Wouldn't we all be better off if we had a nurse for every patient in the hospital instead of having an administrator for every patient? Because that's really what it comes down to. There was a decision that was made. We're going to put all this new money into administration. Why didn't we put it into patient care? And I've been trying to say this for months. It's not about how much money is put into the healthcare system. It's about how it's being put into the healthcare system. And this is the problem with the BCMA agreement. It's the same structure. It's the same system. It's the same process. They haven't touched anything of what was there a week ago. The first $3 billion is staying status quo. And they're not changing the way the new money is going to be delivered either. So how do you expect to do better if you're not changing the way that you run the process?
I can't believe that the government itself isn't asking these questions of the healthcare establishment.
Well, Bill, they don't want to ask the questions because they know what the answer is, and it's not very pretty. They've already put $756 million a year into the BCMA as new money for recruitment and retention, and it made the problem worse. So how can you defend another $10 million is going to fix it? It won't, and they know that. And that's why they're sticking it into a process where the only question that's allowed to be asked is how much is any given physician going to be paid? It's not going to be about the patients. It's not going to be how do we actually redesign the system to make it work better? How do we save taxpayers' money by making the operating rooms work more efficiently? That question is not allowed at the table that they're proposing.
But when I first saw this, I thought it had to be a typing mistake. St. Paul's Hospital, 380 administrators.
I'd welcome you or your listeners to walk around the hospital and have a look for yourself. There's an awful lot of nameplates on doors.
But more administrators than inpatients.
That's the information that we're getting. And, you know, this is not surprising. I remember back in the, back a long time ago when Shaughnessy Hospital was closed, they transferred patients out to other hospitals. That tower was never emptied. It was emptied of patients, and it became an entire office tower for healthcare administrators.
I'm getting some questions about where you're getting your figures. One email says, according to the Independent Canadian Institute for Health Information, BC has the second lowest cost for administration in the country.
I know, and I know the government's been trying to feed that information. Our information is also from the Canadian Institute for Health Information, where they compare BC to the other provinces in terms of overall administrative funding, and we're way higher than Ontario, Alberta, Manitoba, Saskatchewan, Quebec. It's all there. I can send you the report. It's interesting, the government tries to claim that administration is only 4% of the budget here in BC. Fraser Health put out a media release last year where they bragged that they had just gotten under 10%.
Dr. Orfaly, thank you, and I urge people to go to your website to get this information and absorb it the way I have this morning.
Thanks a lot, Bill.